got, hi JJ, I have a procedure booked with you in April, 5 moles on the torso. Just wondering what determines whether the stitches will dissolve or whether they'll need to be removed. Yeah, and it is different when they're on the torso compared to when they're on the face, because the face, and I'll probably tell you this if I haven't told you this already, the face does scar well. So the torso doesn't scar quite so well. And the torso, the face scars well. The face has got a really good blood supply, and the face heals well and scars well. And also, there's a balance when we're doing mole removal. There's a balance between getting the wound healed, which is obviously important, and the cosmetic result of the scar, which is obviously important. And sometimes those two things can be at odds, because if you want the wound to make sure the wound's healed, you're going to leave the stitches in for a longer period of time. But if you're going to want to get a better scar, you're going to want to perhaps get those stitches out sooner. And we do a lot of stuff on the face, and one of the important things on the face is obviously the cosmetic outcome of the scar. And that, combined with the fact that it heals very well because the face has got a good blood supply, means that we will often use non-dissolvable sutures on the face, which will come out at 5 to 7 days. So it's very common to use non-dissolvable sutures on the face because we know it's got a good blood supply, we know it's going to heal well, and also we don't want to get those little dots. We don't want to get those little dots on either side of the scar, those stitch marks. So we will use non-dissolvable sutures, and we will take them out at 5 to 7 days. I usually take them out at 7 days because we know that that's going to give you the best scar possible. Get that suture material out as soon as possible. So on the face, it's very common to use non-dissolvable sutures. On the torso, on the body, it's a little bit different, because if you just did some stitches on the torso and you took them out at 5 to 7 days, I would worry that that would open up. There might be under a little bit more tension, and you would also worry that the wound it hasn't got quite as good a blood supply, the torso, and you would worry that that wouldn't be long enough for the stitches. So we'd often leave the stitches longer on the torso, but as I say, if you leave kind of normal stitches longer, the normal stitches like the ones we put on the face for 2 weeks, say, or 3 weeks, then you're going to get those stitch marks, that classic appearance of the scar with the dots on either side. So we tend not to use, or I say I tend not to use non-dissolvable sutures on the torso. I will use a dissolvable suture on the torso, which will then be buried underneath the skin, so you won't see it, and it's buried underneath the skin, so you don't get those stretch marks. Now, it does mean that stitch lasts longer, because like the face one, we know it's out in a week. That stitch will be in there for several weeks, and that means that the scar will be a bit more red than if we used a non-dissolvable suture. In the long term, it does fade, but it makes a slightly more sort of irritation around the scar, makes the scar a bit more red for a bit longer. But it's kind of like the balance. So on the torso, I usually use a dissolvable suture because I know that's going to last longer, but I bury it underneath the skin so you can't actually see it, so you don't have to have it removed. On the face, I would use a non-dissolvable suture because I want to know that's out in 5 to 7 days, because I want that suture material out of there so that gives less reaction around the scar and a better looking scar, and also I know I can confidently remove it at 5 to 7 days and that wound will be strong enough to sort of take the strain. Great question, and I hope that has answered your question, Mia. And yeah, so so the answer is you're going to have dissolvable sutures on your trunk, probably, and as opposed to the non-dissolvable sutures you had on your face. So yeah.